Question 1. Cost-benefit analysis shows that aggressive management of a patient with end-stage renal disease presenting with significant volume overload, hypertension, and metabolic acidosis requires a multifaceted approach. Given the patient's impaired nephron function, which of the following therapeutic strategies best addresses the underlying pathophysiology and promotes overall patient stability? Option A. Initiate aggressive antihypertensive therapy with vasodilators without addressing fluid overload or acidosis. Option B. Administer loop diuretics to promote sodium and water excretion and provide intravenous sodium bicarbonate to correct the metabolic acidosis. Option C. Focus solely on correcting the metabolic acidosis with intravenous sodium bicarbonate, as this is the most immediate life threat. Option D. Administer intravenous fluids to help flush out accumulated toxins and improve renal perfusion. Correct answer is B. Administer loop diuretics to promote sodium and water excretion and provide intravenous sodium bicarbonate to correct the metabolic acidosis. Explanation. Scenario analysis. This scenario presents a patient with a complex interplay of renal dysfunction, fluid overload, and metabolic acidosis, requiring a nuanced understanding of nephron physiology to guide management. The challenge lies in differentiating the primary drivers of these derangements and selecting interventions that address the root cause while mitigating iatrogenic complications. The physician must balance the immediate need to correct electrolyte imbalances and acid-base status with the long-term goal of preserving renal function and preventing further harm. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's fluid and electrolyte status, considering the impact of impaired glomerular filtration and tubular function. Understanding the nephron's role in sodium and water reabsorption, potassium secretion, and bicarbonate reabsorption is crucial. In this context, recognizing that impaired sodium excretion leads to volume overload and exacerbates hypertension, while also contributing to impaired potassium excretion and potential hyperkalemia, guides the therapeutic strategy. Furthermore, the inability of the damaged nephrons to adequately reabsorb bicarbonate or excrete hydrogen ions directly leads to metabolic acidosis. Therefore, addressing fluid overload with diuretics that act on specific segments of the nephron, e.g., loop diuretics in the loop of Henle, to promote sodium and water excretion, and managing the acidosis with bicarbonate supplementation represents the most physiologically sound and evidence-based approach. This aligns with the principles of patient care and the physician's duty to provide appropriate medical treatment as outlined by osteopathic medical licensing standards, which emphasize a holistic and individualized approach to patient management. Incorrect approaches analysis. One incorrect approach would be to solely focus on diuresis without addressing the underlying acidosis. This fails to recognize that the metabolic acidosis itself can impair the kidney's ability to excrete excess hydrogen ions and reabsorb bicarbonate, potentially worsening the acid-base disturbance and hindering effective diuresis. This represents a failure to address a critical component of the patient's pathophysiology. Another incorrect approach would be to aggressively administer intravenous fluids to flush out the toxins without first addressing the volume, overload, and impaired sodium excretion. This would exacerbate the existing fluid overload, worsen hypertension, and potentially lead to pulmonary edema, demonstrating a lack of understanding of the patient's compromised renal excretory capacity. This approach violates the principle of do no harm by potentially worsening the patient's condition. A third incorrect approach would be to solely focus on correcting the acidosis with bicarbonate without addressing the underlying renal dysfunction and fluid overload. While bicarbonate may temporarily improve the pH, it does not resolve the underlying issues of impaired sodium and water excretion, which will continue to drive fluid overload and potentially worsen renal function. This represents a superficial treatment that fails to address the root cause. Professional reasoning. When faced with a patient exhibiting complex renal and acid-base derangements, the professional decision-making process should involve 1. Thoroughly assessing the patient's clinical presentation, including vital signs, physical examination findings, and laboratory data. 2. Formulating a differential diagnosis that considers the interplay of renal, cardiovascular, and metabolic factors. 3. Prioritizing interventions based on physiological principles and the immediate threat to the patient's well-being. 4. Continuously monitoring the patient's response to treatment and adjusting the management plan accordingly. This systematic approach ensures that all aspects of the patient's condition are considered, leading to the most effective and safest therapeutic outcomes. Question 2. Governance review demonstrates a patient presence to the clinic reporting acute, sharp pain in the upper shoulder region following a fall onto their outstretched arm. The patient describes difficulty lifting their arm and a palpable tenderness over the superior aspect of the shoulder girdle. Considering the bones of the axial and appendicular skeleton, which of the following represents the most appropriate initial diagnostic consideration and subsequent imaging approach? Option A. Consider a fracture of the scapula and order a CT scan of the shoulder girdle. Option B. Focus diagnostic efforts on the sternum and order a chest X-ray. Option C. Suspect a fracture of the clavicle and order plain radiography of the affected area. Option D. Assume a soft tissue injury and recommend rest and ice without further imaging. Correct answer is C. Suspect a fracture of the clavicle and order plain radiography of the affected area. Explanation. Scenario analysis. This scenario presents a common challenge in osteopathic medical practice, where a patient's history and physical examination findings suggest a potential fracture. The challenge lies in accurately identifying the affected bone and understanding its anatomical relationships to guide appropriate diagnostic imaging and treatment, while adhering to the established standards of care and regulatory expectations for patient management. Correct approach analysis. The correct approach involves a systematic assessment of the patient's symptoms and physical findings to pinpoint the likely anatomical location of the injury. This requires a thorough understanding of the bones of the axial and appendicular skeleton, their common injury patterns, and the biomechanics of the human body. By correlating the patient's reported pain, swelling, and limited range of motion with the specific anatomical structures of the clavicle, the physician can then order the most appropriate diagnostic imaging, such as an X-ray, to confirm the suspected fracture. This aligns with the osteopathic principles of patient-centered care and the physician's responsibility to utilize diagnostic tools effectively and efficiently. As expected within the Comprehensive Osteopathic Medical Licensing Examination Level 2, COMLEX Level 2 framework, which emphasizes clinical reasoning and application of foundational medical knowledge. Incorrect approaches analysis. An approach that focuses solely on the axial skeleton without considering the appendicular structures would be incomplete and potentially lead to misdiagnosis or delayed treatment if the injury involves the appendicular skeleton. This fails to meet the comprehensive diagnostic requirements expected in clinical practice. An approach that immediately orders a CT scan without initial plain radiography is often not the most cost-effective or efficient first step for a suspected clavicle fracture and may expose the patient to unnecessary radiation. While CT scans have their place, the initial diagnostic pathway for a suspected uncomplicated fracture typically begins with X-rays. This demonstrates a lack of adherence to established diagnostic algorithms and resource utilization guidelines. An approach that dismisses the patient's symptoms without a thorough physical examination and consideration of potential bony injury would be a significant failure in patient care and a violation of the physician's duty to diagnose and treat. This represents a lapse in clinical judgment and a disregard for the patient's well-being. Professional reasoning. Professionals should approach such scenarios by first gathering a detailed patient history, including the mechanism of injury and symptom description. This is followed by a comprehensive physical examination, focusing on palpation, range of motion, and assessment for signs of trauma. Based on these findings, the physician should then formulate a differential diagnosis, considering the most likely anatomical structures involved. The next step is to select the most appropriate diagnostic imaging modality, balancing diagnostic yield with patient safety and cost-effectiveness. Finally, treatment should be initiated based on the confirmed diagnosis and in accordance with current medical guidelines. Question 3. The audit findings indicate a potential discrepancy in the documentation of a patient's gastrointestinal tract anatomy, specifically regarding the relationship between the pyloric sphincter and the initial segment of the duodenum. The physician is reviewing the patient's chart and the audit report. Which of the following actions best represents a professional and clinically sound approach to address this discrepancy? Option A. Disregard the audit findings, as the physician's clinical experience is sufficient to override any documentation concerns. Option B. Review the patient's imaging studies and consult relevant anatomical resources to confirm the expected anatomical relationship of the pyloric sphincter and the duodenum, Then correlate this with the patient's clinical presentation and the specific documentation in question. Option C. Focus solely on the anatomical description in the audit report without considering the patient's overall clinical condition or other aspects of their gastrointestinal health. Option D. Immediately amend the patient's medical record to reflect the anatomical description suggested by the audit findings, assuming the audit is correct. Correct answer is B. Review the patient's imaging studies and consult relevant anatomical resources to confirm the expected anatomical relationship of the pyloric sphincter and the duodenum. Then correlate this with the patient's clinical presentation and the specific documentation in question. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a discrepancy between documented patient care and actual clinical practice, potentially impacting patient safety and adherence to established medical standards. The physician must navigate the complexities of gastrointestinal anatomy and physiology to ensure accurate diagnosis and treatment, while also addressing the audit's findings. The challenge lies in reconciling the audit's observations with the physician's understanding of the patient's condition and the anatomical structures involved. Correct approach analysis. The correct approach involves a thorough review of the patient's medical record, cross-referencing the audit findings with the physician's clinical assessment and knowledge of gastrointestinal anatomy. This ensures that any identified deviations are understood in the context of the patient's specific presentation and the normal anatomical relationships of the digestive tract and accessory organs. This approach aligns with the osteopathic principles of patient-centered care and the physician's responsibility to maintain accurate and comprehensive medical documentation, adhering to the standards set forth by the Comprehensive Osteopathic Medical Licensing Examination Level 2, COMLEX USA framework, which emphasizes clinical competence and ethical practice. Incorrect approaches analysis. One incorrect approach would be to dismiss the audit findings without further investigation, assuming the documentation is accurate and the audit is flawed. This fails to acknowledge the potential for error in clinical practice or documentation, and neglects the physician's duty to ensure quality patient care, potentially violating ethical guidelines and the spirit of the COMLEX USA examinations focus on patient safety. Another incorrect approach would be to immediately alter the patient's medical record to conform to the audit findings without a clinical basis. This constitutes falsification of medical records, a serious ethical and regulatory violation. It undermines the integrity of the medical record, which is crucial for continuity of care and legal purposes, and directly contravenes the principles of honest and accurate medical practice expected in the COMLEX USA. A third incorrect approach would be to focus solely on the anatomical structures mentioned in the audit, without considering the broader clinical context or the patient's overall gastrointestinal health. This narrow focus can lead to incomplete assessments and potentially inappropriate interventions, failing to address the patient's needs holistically, which is a cornerstone of osteopathic medicine and the comprehensive evaluation expected in the COMLEX USA. Professional reasoning. Professionals should approach such situations by prioritizing patient well-being and adherence to established medical standards. This involves a systematic process of 1. Acknowledging and investigating audit findings. 2. Critically evaluating the findings against clinical data and anatomical knowledge. 3. Consulting with colleagues or specialists if necessary. 4. Making evidence-based decisions regarding patient care and documentation. 5. Ensuring all actions are ethically sound and compliant with regulatory requirements. This methodical approach ensures that patient care remains paramount and that professional integrity is maintained. Question 4. The performance metrics show a 68-year-old male presenting to the emergency department with acute shortness of breath and hypotension. His blood pressure is 80/40 mmHg. Heart rate is 110 bpm, respiratory rate is 28 breaths/min, and oxygen saturation is 88% on room air. Physical examination reveals cool extremities, delayed capillary refill, and bilateral crackles in the lung bases. Initial laboratory results show elevated lactate. The physician is considering the initial management steps. Option A. Administer intravenous fluids cautiously, assess for signs of fluid overload, and consider inotropic support if cardiac output appears low. Option B. Administer intravenous fluids aggressively, followed by a trial of a broad-spectrum vasopressor if hypotension persists. Option C. Obtain a portable chest X-ray and initiate a pulmonary artery catheterization to assess cardiac filling pressures and cardiac output. Option D. Immediately initiate high-dose norepinephrine to rapidly increase blood pressure. The correct answer is B. Administer intravenous fluids aggressively, followed by a trial of a broad-spectrum vasopressor if hypotension persists. Explanation: this scenario presents a clinically challenging situation requiring a physician to interpret complex physiological data in the context of a patient's acute presentation. The challenge lies in synthesizing information from multiple physiological systems, cardiovascular, respiratory, to arrive at an accurate diagnosis and management plan, while adhering to the standards of care expected of a physician licensed under the Comprehensive Osteopathic Medical Licensing Examination Level 2, Complex Roman II, jurisdiction. This jurisdiction emphasizes evidence-based practice and adherence to established clinical guidelines. The correct approach represents best professional practice because it involves a systematic and comprehensive evaluation of the patient's hemodynamic status. Understanding the interplay between cardiac output, systemic vascular resistance, and mean arterial pressure is fundamental to diagnosing and managing shock states. Specifically, recognizing that a low cardiac output with elevated systemic vascular resistance points towards a cardiogenic or obstructive etiology, while a high cardiac output with low systemic vascular resistance suggests a distributive shock, is crucial. The correct approach prioritizes identifying the underlying cause of the patient's hypotension and hypoxemia, which is essential for initiating appropriate, targeted therapy and preventing further deterioration, aligning with the Complex Roman II focus on patient safety and effective clinical reasoning. An incorrect approach that focuses solely on administering fluids without a thorough assessment of the patient's volume status and cardiac function would be a significant regulatory and ethical failure. This could lead to fluid overload in a patient with compromised cardiac function, exacerbating pulmonary edema and worsening their condition. This failure violates the principle of do no harm and demonstrates a lack of appropriate clinical judgment, which is a cornerstone of physician licensure under Complex Roman II. Another incorrect approach, such as immediately initiating broad-spectrum vasopressors without identifying the specific type of shock, could also be detrimental. While vasopressors are vital in managing hypotension, their inappropriate use can worsen tissue perfusion in certain shock states, e.g., increasing afterload in cardiogenic shock, and mask the underlying problem, representing a failure to adhere to evidence-based treatment protocols. The professional reasoning process for similar situations should involve a structured approach. 1. Rapidly assess the patient's airway, breathing, and circulation, ABCs. 2. Obtain vital signs, including blood pressure, heart rate, respiratory rate, and oxygen saturation. 3. Perform a focused physical examination, paying attention to signs of hypoperfusion and fluid status. 4. Review available diagnostic data, including laboratory results and imaging. 5. Formulate a differential diagnosis based on the patient's presentation and data. 6. Initiate empiric treatment while simultaneously pursuing definitive diagnosis and management. 7. Continuously reassess the patient's response to treatment and adjust the plan accordingly. This systematic approach ensures that all critical aspects of the patient's condition are considered, leading to safer and more effective patient care, in accordance with the standards expected by the Complex Roman II. Question 5. System analysis indicates a 65-year-old male presents with intermittent shortness of breath and mild chest discomfort. Physical examination reveals a regular heart rhythm with no murmurs, but a palpable pulsation in the suprasternal notch. An echocardiogram demonstrates mild aortic regurgitation and a dilated aortic root measuring 4.8 cm. Considering the patient's presentation and diagnostic findings, which of the following represents the most appropriate next step in management? Option A. Refer the patient to a cardiothoracic surgeon for evaluation of potential aortic root repair. Option B. Recommend lifestyle modifications and reassure the patient that the findings are likely benign. Option C. Order a cardiac catheterization to assess coronary artery disease and the severity of aortic regurgitation. Option D. Initiate a trial of antihypertensive medication and schedule a follow-up echocardiogram in 1 year. The correct answer is D. Initiate a trial of antihypertensive medication and schedule a follow-up echocardiogram in 1 year. Explanation: scenario analysis. This scenario presents a common clinical challenge where a physician must interpret complex cardiovascular findings in the context of a patient's symptoms and medical history. The challenge lies in synthesizing information from various sources, including physical examination, diagnostic imaging, and patient-reported symptoms, to arrive at an accurate diagnosis and appropriate management plan. The physician must also consider the potential impact of underlying anatomical variations or pathologies on the patient's overall cardiovascular health and prognosis. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation of the patient's cardiovascular system, integrating all available data. This includes a thorough physical examination focusing on cardiac auscultation, palpation, and assessment of peripheral pulses and edema. Correlating these findings with the echocardiogram results, which provide detailed structural and functional information about the heart, is crucial. Furthermore, understanding the implications of the identified aortic root dilation in relation to the patient's symptoms and risk factors is paramount. This holistic approach aligns with best practices in osteopathic medicine, emphasizing the interconnectedness of the body systems and the importance of a patient-centered, evidence-based diagnostic process. Adherence to the principles of the Comprehensive Osteopathic Medical Licensing Examination Level 2, COMLEX USA Level 2, requires the application of clinical knowledge and reasoning to patient care scenarios, ensuring safe and effective practice. Incorrect approaches analysis. One incorrect approach would be to solely rely on the echocardiogram findings without a thorough physical examination or consideration of the patient's symptoms. This fails to acknowledge the dynamic nature of cardiovascular function and the potential for discrepancies between imaging and clinical presentation. It also neglects the osteopathic tenet of treating the whole person. Ethically and regulatorily, this could lead to misdiagnoses or delayed treatment, potentially violating the standard of care expected of licensed physicians. Another incorrect approach would be to dismiss the aortic root dilation as an incidental finding without further investigation, especially given the patient's reported symptoms. This demonstrates a failure to connect potential anatomical abnormalities with clinical manifestations, which is a critical aspect of diagnostic reasoning. Such an oversight could have serious consequences if the dilation is indicative of a progressive condition. This approach would be contrary to the principles of thoroughness and due diligence mandated by medical licensing bodies. A third incorrect approach would be to focus exclusively on managing the patient's symptoms without addressing the underlying anatomical issue identified by the echocardiogram. While symptom management is important, it does not constitute a complete diagnostic and therapeutic strategy. This approach risks treating the effects rather than the cause, potentially leading to suboptimal outcomes and failing to prevent disease progression. This would be a failure to adhere to the comprehensive care standards expected in medical practice. Professional reasoning. Professionals should approach such scenarios by first gathering all available patient information, including history, physical examination findings, and diagnostic test results. They should then critically analyze this information, looking for correlations and potential discrepancies. The next step involves formulating a differential diagnosis based on the integrated data. Finally, the physician should develop a management plan that addresses the underlying pathology, manages symptoms, and considers the patient's overall health and prognosis, always adhering to established medical guidelines and ethical principles. Question 6. Governance review demonstrates a need to reinforce the understanding of male reproductive anatomy among osteopathic physicians preparing for the Comprehensive Osteopathic Medical Licensing Examination Level 2, particularly when presented with a patient experiencing acute scrotal pain and swelling. Which of the following anatomical considerations is most critical for accurate diagnosis in such a case? Option A. General assessment of the scrotal sac's external dimensions and skin integrity. Option B. Consideration of referred pain patterns from the lumbar spine to the scrotum. Option C. Precise identification of the location and relationship of the testes, epididymis, and vas deferens within the scrotal sac. Option D. Evaluation of the prostate gland size and consistency via digital rectal examination. The correct answer is C. Precise identification of the location and relationship of the testes, epididymis, and vas deferens within the scrotal sac. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of male reproductive anatomy and the potential for misinterpretation or incomplete understanding of its structures and functions, particularly in the context of a diagnostic scenario. The physician must accurately identify the anatomical structures involved to correctly diagnose the patient's condition and formulate an appropriate treatment plan. Failure to do so can lead to misdiagnosis, delayed treatment, or inappropriate interventions, all of which have significant clinical and ethical implications. Correct approach analysis. The correct approach involves a thorough and accurate identification of the anatomical structures of the male reproductive system, specifically focusing on the testes, epididymis, and vas deferens, and their relationship to the scrotal sac. This precise anatomical understanding is fundamental to diagnosing conditions like epididymitis or testicular torsion, which present with scrotal pain and swelling. Best professional practice, as guided by the principles of osteopathic medicine and the standards of care expected in the U.S. medical licensing framework, mandates accurate diagnosis based on sound anatomical knowledge. This ensures patient safety and adherence to the ethical obligation to provide competent care. Incorrect approaches analysis. One incorrect approach would be to focus solely on the external appearance of the scrotum without considering the internal anatomical structures. This is a failure of diagnostic rigor and neglects the underlying pathology that causes scrotal abnormalities. Ethically, it represents a deviation from the standard of care, potentially leading to a missed or delayed diagnosis. Another incorrect approach would be to generalize the symptoms to a common but less specific condition without a detailed anatomical assessment. This demonstrates a lack of thoroughness and can result in misdiagnosis. From a regulatory perspective, it falls short of the expected level of diagnostic competence required for medical licensure. A third incorrect approach would be to attribute the symptoms to a non-anatomical cause without first ruling out all possible anatomical explanations. This is a significant diagnostic error and a failure to adhere to the systematic approach required in clinical medicine. It violates the ethical duty to investigate thoroughly and can have serious consequences for patient health. Professional reasoning. Professionals facing such a scenario should employ a systematic diagnostic process. This begins with a comprehensive history and physical examination, with a particular emphasis on detailed anatomical assessment of the affected region. Imaging studies, when indicated, should be interpreted in conjunction with the clinical findings and anatomical knowledge. The decision-making process should prioritize accuracy and patient safety, adhering to established medical guidelines and ethical principles. When in doubt, consultation with specialists or further diagnostic investigation is warranted. Question 7. Process analysis reveals a 65-year-old male patient presenting with symptoms suggestive of severe dehydration and electrolyte imbalance, likely due to a gastrointestinal illness. Laboratory results indicate critically low sodium levels, consistent with hyponatremia. The physician explains that the body's ability to regulate water and electrolyte balance is significantly impaired, involving complex membrane transport mechanisms such as aquaporins and sodium-potassium pumps, which are failing to maintain osmotic equilibrium. The recommended treatment is intravenous fluid resuscitation with a carefully calculated hypertonic saline solution to gradually correct the sodium deficit and restore normal cellular function. The patient, however, expresses a strong aversion to needles and Roman IV, stating he believes his body will flush out the bad stuff on its own and refuses the proposed treatment. What is the most appropriate course of action for the physician in this ethically and medically challenging situation? Option A. Refer the patient to a psychiatrist to assess his mental capacity, as his refusal of life-saving treatment is likely due to a psychological issue. Option B. Document the patient's refusal after a thorough explanation of the risks, benefits, and alternatives, including the physiological consequences of untreated hyponatremia on cellular membrane transport, and continue to offer supportive care and re-education. Option C. Respect the patient's refusal without further discussion, assuming his belief about flushing out the bad stuff is sufficient for his decision-making. Option D. Administer the intravenous fluids immediately, explaining to the patient that his life is in danger and his refusal cannot be accepted in this critical situation. Correct answer is B. Document the patient's refusal after a thorough explanation of the risks, benefits, and alternatives, including the physiological consequences of untreated hyponatremia on cellular membrane transport, and continue to offer supportive care and re-education. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a patient with a potentially life-threatening condition where the standard of care is clear, but the patient's personal beliefs create a conflict with that standard. The physician must balance their ethical and legal obligations to provide appropriate medical treatment with the patient's right to refuse treatment, even if that refusal is based on misinformation or misunderstanding. The complexity arises from the potential for severe harm or death if the recommended treatment is not administered, and the physician's responsibility to act in the patient's best interest while respecting their autonomy. Correct approach analysis. The correct approach involves a multifaceted strategy focused on patient education, exploring the underlying reasons for refusal, and seeking to achieve informed consent for the necessary intervention. This aligns with the core ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make decisions about their own body. Legally, physicians are obligated to provide a standard of care, but this must be done in a way that respects patient rights. The physician should clearly explain the diagnosis, the rationale for the recommended treatment, including the specific membrane transport mechanisms involved in the disease process and how the treatment addresses them, the risks and benefits of the treatment, and the consequences of refusing treatment. This process aims to empower the patient to make a truly informed decision. If the patient remains unable to consent due to cognitive impairment, the physician must then follow established protocols for surrogate decision-making, which is a legal and ethical imperative. Incorrect approaches analysis. One incorrect approach is to immediately override the patient's refusal and administer treatment against their will. This violates the principle of patient autonomy and could lead to legal repercussions for battery. While beneficence is a consideration, it does not supersede a competent patient's right to refuse treatment, even if that refusal is deemed medically unwise. Another incorrect approach is to simply accept the patient's refusal without further investigation or education. This fails the physician's duty of beneficence and could be considered medical negligence if the patient suffers harm as a result of the untreated condition. The physician has a responsibility to ensure the patient understands the implications of their decision. A third incorrect approach is to dismiss the patient's concerns as irrational without attempting to understand their perspective. This demonstrates a lack of empathy and can erode the patient-physician relationship, making it harder to achieve any form of agreement or provide future care. It also fails to address potential underlying fears or misinformation that might be contributing to the refusal. Professional reasoning. Professionals should approach such dilemmas by first ensuring the patient's capacity to make decisions. If capacity is present, the focus shifts to thorough, clear, and empathetic communication. This involves explaining the medical necessity, the underlying pathophysiology, including membrane transport mechanisms, and the potential outcomes of both treatment and refusal. The physician should actively listen to the patient's concerns, address misinformation, and explore alternatives if medically appropriate and safe. If the patient remains unwilling to consent and has capacity, the physician must document the discussion and the patient's decision while continuing to offer supportive care. If capacity is lacking, the physician must engage with the designated surrogate decision-maker, following established legal and ethical guidelines. Question 8. The evaluation methodology shows a 65-year-old male presenting with sudden onset of unilateral facial weakness, difficulty chewing, and altered taste sensation on the same side of the face. He denies any visual changes or limb weakness. Which of the following cranial nerves is most likely affected, and what is the primary diagnostic approach to confirm this suspicion? Option A. Trigeminal nerve V. Assess sensation in the face and jaw opening strength. Option B. Vestibulocochlear nerve Roman 8. Evaluate hearing and balance. Option C. Glossopharyngeal nerve Roman 9. Assess gag reflex and palatal elevation. Option D. Facial nerve Roman 7. Perform a detailed assessment of facial muscle strength, taste sensation, and auditory reflex. The correct answer is D. Facial nerve Roman 7. Perform a detailed assessment of facial muscle strength, taste sensation, and auditory reflex. Explanation. The evaluation methodology shows a physician presented with a patient exhibiting symptoms suggestive of a cranial nerve deficit. The challenge lies in accurately localizing the lesion within the complex network of cranial nerves, which requires a systematic neurological examination and a thorough understanding of neuroanatomy and neurophysiology. Misdiagnosis can lead to delayed or inappropriate treatment, potentially causing irreversible neurological damage, and impacting the patient's quality of life. Adherence to established diagnostic protocols and a comprehensive understanding of the peripheral nervous system, specifically cranial nerves, are paramount. The correct approach involves a detailed cranial nerve examination, correlating the observed deficits with specific nerve pathways and their central connections. This systematic evaluation, guided by established neurological assessment principles, allows for precise localization of the lesion. This aligns with the osteopathic principles of patient-centered care and the commitment to accurate diagnosis and effective treatment, as mandated by the Comprehensive Osteopathic Medical Licensing Examination Level 2, COMLEX USA framework, which emphasizes evidence-based practice and clinical reasoning. An incorrect approach would be to rely solely on a limited set of symptoms without a comprehensive examination, leading to a premature or inaccurate diagnosis. This fails to meet the standard of care expected in neurological assessment and violates the ethical obligation to provide thorough and competent medical care. Another incorrect approach would be to attribute symptoms to a central nervous system lesion without first ruling out peripheral causes, demonstrating a failure in differential diagnosis and a lack of systematic investigation. This also deviates from the expected diagnostic rigor. A further incorrect approach would be to initiate treatment based on a presumptive diagnosis without definitive localization, which is contrary to best medical practice and could lead to iatrogenic harm. Professionals should employ a decision-making framework that begins with a detailed history and a systematic physical examination, including a targeted cranial nerve assessment. This should be followed by a process of differential diagnosis, systematically considering and ruling out potential causes based on the findings. Imaging or other diagnostic studies should be ordered judiciously to confirm or refute suspected diagnoses. Throughout this process, continuous reassessment and integration of new information are crucial for arriving at the most accurate diagnosis and developing an appropriate management plan. Question 9. Strategic planning requires a physician to consider the intricate molecular processes that underpin cellular function. A patient presents with a constellation of symptoms suggestive of a systemic disorder, but initial broad-spectrum treatments have yielded no improvement. The physician suspects an underlying defect in cellular machinery. Which of the following investigations would be most appropriate to explore potential disruptions in protein function due to alterations in their production or modification? Option A. Genetic sequencing of genes known to be involved in the patient's presenting symptoms to identify inherited predispositions. Option B. Analysis of the patient's complete blood count and basic metabolic panel to assess general organ function. Option C. Investigation into the patient's proteome, focusing on the presence and activity of specific proteins and examining their post-translational modification status. Option D. Assessment of the patient's lifestyle factors, including diet and exercise, to rule out environmental influences on their health. The correct answer is B. Analysis of the patient's complete blood count and basic metabolic panel to assess general organ function. Explanation. Scenario analysis. This scenario presents a clinically challenging situation where a patient's symptoms are not responding to standard treatment, necessitating a deeper investigation into cellular mechanisms. The physician must consider the complex interplay of protein synthesis and post-translational modification, which can significantly alter protein function and cellular processes. Misinterpreting these mechanisms could lead to incorrect diagnoses and ineffective treatment strategies, impacting patient outcomes. The challenge lies in applying foundational scientific knowledge to a real-world clinical problem, requiring a systematic approach to differential diagnosis. Correct approach analysis. The correct approach involves recognizing that impaired protein synthesis or aberrant post-translational modifications can manifest as a variety of clinical symptoms, including those related to immune function, metabolic pathways, or cellular signaling. Specifically, understanding that certain post-translational modifications, such as phosphorylation or glycosylation, are crucial for protein activity and localization, allows the physician to hypothesize about underlying molecular defects. For instance, if a patient presents with a deficiency in a specific enzyme, investigating the gene responsible for its synthesis and the subsequent modifications it undergoes is a logical diagnostic step. This aligns with the principles of evidence-based medicine and the osteopathic philosophy of treating the whole person, by understanding the underlying pathophysiology. The Comprehensive Osteopathic Medical Licensing Examination Level 2, COMLEX USA Level 2, emphasizes the application of scientific knowledge to clinical problem solving, and this approach directly addresses that requirement by linking molecular biology to patient care. Incorrect approaches analysis. One incorrect approach would be to solely focus on symptomatic treatment without investigating the root cause at the molecular level. This fails to address the underlying pathophysiology and may lead to prolonged illness or the development of secondary complications. Ethically, this represents a failure to provide comprehensive care and to pursue the most effective diagnostic and therapeutic strategies available. Another incorrect approach would be to prematurely conclude a diagnosis based on a single, isolated laboratory finding without considering the broader context of protein synthesis and modification. For example, identifying a single abnormal protein level without investigating its synthesis pathway or potential post-translational alterations would be insufficient. This demonstrates a lack of thoroughness in the diagnostic process and could lead to misdiagnosis. A third incorrect approach would be to dismiss the possibility of a genetic or molecular defect and attribute the patient's condition solely to environmental factors or lifestyle choices, especially when standard treatments are ineffective. This overlooks the significant role that genetic predispositions and molecular dysregulation play in disease pathogenesis and represents a failure to apply a holistic, evidence-based approach to patient care. Professional reasoning. Professionals facing similar situations should employ a systematic diagnostic framework. This begins with a thorough patient history and physical examination, followed by the formulation of differential diagnoses. When initial investigations are inconclusive, the physician should then consider deeper levels of biological inquiry, such as cellular and molecular mechanisms. This involves hypothesizing potential defects in protein synthesis, folding, or post-translational modifications based on the patient's specific clinical presentation. Consulting relevant literature and seeking input from specialists can further refine the diagnostic process. The ultimate goal is to identify the precise underlying cause of the patient's illness to guide effective and targeted treatment. Question 10. Quality control measures reveal a discrepancy in how physicians are documenting their assessments of patients presenting with complex multi-system complaints. Specifically, some physicians are focusing their documentation heavily on a single organ system that appears to be the primary source of the patient's chief complaint, while others are meticulously detailing the function of each organ system, even those not immediately implicated by the chief complaint. A third group is prioritizing anecdotal patient reports about the perceived cause of their illness over objective findings. Which of the following approaches to documenting organ system assessment best reflects the comprehensive and integrated approach expected in osteopathic medical practice, ensuring thoroughness and adherence to professional standards? Option A. Documenting the function of each organ system, noting any deviations from normal, and considering how these systems interact and contribute to the patient's overall health status, even if not directly related to the chief complaint. Option B. Prioritizing the documentation of subjective patient narratives regarding the perceived cause of their illness, integrating these accounts as the primary basis for the organ system assessment. Option C. Focusing documentation primarily on the organ system most directly associated with the patient's chief complaint, providing a detailed account of its function and any observed abnormalities. Option D. Documenting only the organ systems that exhibit clear, objective signs of pathology, omitting any discussion of systems that appear to be functioning normally or are not immediately implicated. The correct answer is A. Documenting the function of each organ system, noting any deviations from normal, and considering how these systems interact and contribute to the patient's overall health status, even if not directly related to the chief complaint. Explanation. This scenario presents a professional challenge due to the inherent complexity of comparing organ system function across different physiological states, requiring a nuanced understanding of normal versus pathological processes. The physician must accurately assess the patient's current condition and differentiate between expected physiological adaptations and signs of disease. Careful judgment is required to avoid misinterpreting normal variations as pathology or vice versa, which could lead to inappropriate diagnostic or therapeutic interventions. The correct approach represents best professional practice because it systematically evaluates each organ system's contribution to the patient's overall presentation, considering both subjective complaints and objective findings. This comprehensive, system-by-system analysis, grounded in osteopathic principles of integrating structure and function, allows for a holistic understanding of the patient's health status. It aligns with the osteopathic philosophy of treating the whole person and identifying the root cause of illness, rather than just managing symptoms. This approach is ethically sound as it prioritizes patient well-being through thorough and accurate assessment, adhering to the principle of beneficence. An incorrect approach that focuses solely on a single organ system, without considering its interaction with others, fails to acknowledge the interconnectedness of the body's systems. This can lead to a fragmented understanding of the patient's condition and potentially misdiagnoses or ineffective treatments. Ethically, this approach risks violating the principle of non-maleficence by potentially leading to harm through incomplete or inaccurate assessment. Another incorrect approach that prioritizes subjective patient reports over objective physical findings or diagnostic data is professionally unsound. While patient history is crucial, it must be corroborated and contextualized by objective evidence. Relying solely on subjective information can lead to misdiagnosis and inappropriate management, failing to meet the standard of care expected in medical practice. This approach also fails to uphold the principle of justice by potentially leading to unequal or substandard care. A further incorrect approach that relies on anecdotal evidence or unverified information from non-professional sources is a significant ethical and professional failure. This undermines the scientific basis of medicine and can expose the patient to dangerous misinformation. It directly contradicts the principles of evidence-based practice and patient safety, and could be considered a breach of professional responsibility. The professional decision-making process for similar situations should involve a structured, systematic approach to patient assessment. This includes obtaining a thorough history, performing a comprehensive physical examination, and utilizing appropriate diagnostic tools. The physician should then synthesize this information, considering the interplay between different organ systems and the patient's unique physiological context. This iterative process of data gathering, analysis, and hypothesis testing, guided by established medical knowledge and osteopathic principles, ensures the most accurate and effective patient care. Question 11. Assessment of a patient presenting with progressive neurological deficits reveals genetic testing results indicating a significant upregulation of a specific microRNA, miRNA, known to inhibit the translation of mRNA encoding a critical synaptic protein. The physician is considering the implications of this finding for the patient's condition and potential therapeutic strategies. Which of the following represents the most appropriate next step in the diagnostic and management process? Option A. Correlate the miRNA findings with the patient's specific neurological symptoms, disease progression, and other laboratory and imaging results to formulate a comprehensive diagnostic assessment and guide further investigation or treatment. Option B. Order additional, unrelated genetic tests for entirely different conditions to broaden the diagnostic scope, without directly addressing the implications of the identified miRNA abnormality. Option C. Immediately initiate a therapeutic trial targeting the identified miRNA pathway, assuming it is the sole cause of the patient's symptoms, without further diagnostic confirmation. Option D. Disregard the miRNA findings as preliminary and focus solely on more conventional diagnostic workups for neurological disorders, as miRNA dysregulation is not yet a widely established diagnostic marker. The correct answer is A. Correlate the miRNA findings with the patient's specific neurological symptoms, disease progression, and other laboratory and imaging results to formulate a comprehensive diagnostic assessment and guide further investigation or treatment. Explanation. This scenario presents a professionally challenging situation because it requires the physician to interpret complex molecular biology findings in the context of a patient's clinical presentation and potential treatment implications, all while adhering to the strict regulatory framework governing medical practice and patient care. The challenge lies in accurately assessing the significance of altered RNA synthesis and processing in relation to the patient's symptoms, and determining the most appropriate diagnostic and therapeutic path forward, ensuring all actions are compliant with established medical standards and ethical guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation. This involves correlating the molecular findings with the patient's clinical picture, considering differential diagnoses, and consulting relevant literature and specialists. This aligns with the osteopathic medical licensing examination's emphasis on integrating scientific knowledge with clinical application and patient-centered care. Adherence to established diagnostic protocols and ethical considerations regarding informed consent and patient well-being are paramount. An incorrect approach that focuses solely on the molecular findings without clinical correlation would be professionally unacceptable. This failure to integrate all available data points can lead to misdiagnosis or inappropriate treatment, violating the physician's duty of care. Another incorrect approach that involves immediate, unverified therapeutic interventions based on preliminary RNA data would be ethically and regulatorily unsound, as it bypasses necessary diagnostic steps and could expose the patient to unnecessary risks. A third incorrect approach that dismisses the RNA findings as irrelevant without thorough investigation would also be a failure, potentially overlooking a crucial diagnostic clue and thus not providing optimal patient care. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understand the patient's clinical presentation. Second, critically evaluate all diagnostic data, including molecular findings. Third, consult relevant medical literature and expert opinions. Fourth, develop a differential diagnosis. Fifth, formulate a treatment plan that is evidence-based and patient-centered. And finally, continuously monitor the patient's response and adjust the plan as needed, always within the bounds of regulatory compliance and ethical practice. Question 12. Comparative studies suggest that disruptions in cellular energy production pathways can manifest with a wide range of clinical signs and symptoms. A patient presents with progressive fatigue, muscle weakness, and intermittent neurological deficits. Laboratory investigations reveal elevated lactate levels, a decreased ratio of ATP to ADP, and impaired mitochondrial respiration. Considering the interconnectedness of cellular metabolism, which of the following represents the most likely primary site of dysfunction contributing to this patient's presentation? Option A, an excessive flux through the Krebs cycle leading to an accumulation of citrate. Option B, a primary overactivity of phosphofructokinase in the glycolytic pathway. Option C, a complete blockage of pyruvate dehydrogenase complex activity. Option D, a significant impairment in the electron transport chain and oxidative phosphorylation. Correct answer is D, a significant impairment in the electron transport chain and oxidative phosphorylation. Explanation: scenario analysis. This scenario presents a professionally challenging situation because it requires the physician to interpret complex cellular metabolic data in the context of a patient's clinical presentation and make a critical diagnostic and therapeutic decision. The challenge lies in integrating knowledge of glycolysis, the Krebs cycle, and oxidative phosphorylation with the patient's symptoms, which may be subtle or mimic other conditions. Misinterpreting the metabolic data could lead to delayed or incorrect diagnosis, potentially harming the patient. Careful judgment is required to differentiate between normal metabolic variations, adaptive responses, and pathological states. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's clinical signs and symptoms, correlating them with the provided metabolic data. This approach represents best professional practice because it adheres to the principles of evidence-based medicine and patient-centered care, which are foundational to osteopathic medical practice, as governed by the Comprehensive Osteopathic Medical Licensing Examination Level 2, COMLEX 2 framework. Specifically, it aligns with the ethical obligation to provide competent medical care, which necessitates accurate diagnosis and appropriate management based on a thorough understanding of physiological processes and their disruption. The physician must consider how dysregulation in glycolysis, the Krebs cycle, or oxidative phosphorylation could manifest clinically, and then determine the most likely underlying cause. This requires a deep understanding of the interconnectedness of these metabolic pathways and their impact on cellular function and overall patient health. Incorrect approach is analysis. An incorrect approach would be to solely focus on the metabolic data without considering the patient's clinical presentation. This is professionally unacceptable because it ignores the fundamental principle that laboratory data must always be interpreted within the clinical context. Such an approach could lead to misdiagnosis if the metabolic findings are incidental or represent a non-pathological adaptation. It also fails to meet the ethical standard of comprehensive patient assessment. Another incorrect approach would be to rely on anecdotal evidence or personal experience without consulting current scientific literature or established diagnostic guidelines. This is professionally unacceptable as it deviates from evidence-based practice and risks perpetuating outdated or inaccurate medical knowledge. The COMLEX 2 framework emphasizes the importance of staying current with medical advancements and adhering to recognized standards of care. A third incorrect approach would be to make a diagnosis based on a single metabolic pathway abnormality, without considering the potential interplay and compensatory mechanisms between glycolysis, the Krebs cycle, and oxidative phosphorylation. This oversimplification can lead to an incomplete or inaccurate understanding of the patient's condition, potentially resulting in ineffective or harmful treatment. Professional practice demands a holistic understanding of cellular metabolism and its systemic implications. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough patient history and physical examination. This is followed by a review of all available diagnostic data, including laboratory results, imaging, and any provided metabolic profiles. The physician must then synthesize this information, forming differential diagnoses. For each potential diagnosis, the physician should consider how it aligns with the observed metabolic derangements and clinical findings. The COMLEX 2 framework emphasizes critical thinking and problem-solving skills, requiring physicians to integrate scientific knowledge with clinical judgment to arrive at the most accurate diagnosis and develop an appropriate, individualized treatment plan. This process involves continuous evaluation and adaptation as new information becomes available. Question 13. The evaluation methodology shows a 45-year-old male presenting with acute onset of severe, colicky right flank pain radiating to the groin, accompanied by gross hematuria and nausea. He denies fever or dysuria. The physician is considering several potential diagnoses. Which of the following diagnostic strategies best reflects a systematic and evidence-based approach to differentiate between the most likely causes of his symptoms? Option A. Administer intravenous fluids and analgesics and schedule a non-contrast helical CT scan of the abdomen and pelvis within 24 hours to visualize potential urinary tract calculi. Option B. Initiate empiric treatment for pyelonephritis with intravenous antibiotics and pain management, and reevaluate in 48 hours if symptoms do not improve. Option C. Immediately obtain a urinalysis to confirm hematuria, followed by a urine culture and sensitivity to rule out infection, and then empirical treatment with broad-spectrum antibiotics. Option D. Order a complete metabolic panel, including renal function tests, and a renal ultrasound to assess for hydronephrosis and possible stones, while awaiting results before further investigation. The correct answer is A. Administer intravenous fluids and analgesics, and schedule a non-contrast helical CT scan of the abdomen and pelvis within 24 hours to visualize potential urinary tract calculi. Explanation. The evaluation methodology shows a scenario where a physician must differentiate between two common causes of flank pain and hematuria, one of which requires immediate intervention to prevent permanent kidney damage. The professional challenge lies in accurately and efficiently diagnosing the underlying cause to initiate appropriate management, balancing the need for thoroughness with the urgency of potential complications. This requires a systematic approach to patient assessment, integrating history, physical examination, and judicious use of diagnostic tools. The correct approach represents best professional practice because it prioritizes diagnostic accuracy and patient safety, aligning with the core principles of osteopathic medical practice and the standards of care expected by the Comprehensive Osteopathic Medical Licensing Examination Level 2. Specifically, it involves a stepwise diagnostic process that begins with a detailed history and physical examination to gather initial clues, followed by targeted laboratory and imaging studies. This methodical approach ensures that all relevant differential diagnoses are considered and systematically ruled out or confirmed, leading to the most appropriate treatment plan. This aligns with the ethical obligation to provide competent care and the regulatory expectation to practice evidence-based medicine. An incorrect approach that relies solely on empirical treatment without a definitive diagnosis fails to meet professional standards. This could lead to delayed or incorrect treatment, potentially worsening the patient's condition or causing harm. Ethically, it violates the principle of non-maleficence by exposing the patient to unnecessary risks. From a regulatory standpoint, it demonstrates a lack of due diligence in diagnostic workup, which could be grounds for professional censure. Another incorrect approach that involves extensive, unfocused testing without a clear diagnostic hypothesis is inefficient and costly, potentially exposing the patient to unnecessary radiation or invasive procedures. While thoroughness is important, it must be guided by clinical reasoning. This approach could be seen as a failure to practice cost-effectively and efficiently, which is an implicit expectation in healthcare delivery. A third incorrect approach that prematurely dismisses a serious diagnosis based on initial, incomplete findings is a critical error. This could lead to a misdiagnosis of a life-threatening condition, resulting in severe morbidity or mortality. This represents a significant ethical failure in patient advocacy and a breach of the standard of care, with serious regulatory implications. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough history and physical examination to elicit key symptoms and signs. 2. Development of a comprehensive differential diagnosis based on the initial assessment. 3. Prioritization of diagnostic tests based on the likelihood of specific diagnoses and the urgency of intervention. 4. Systematic interpretation of diagnostic results in the context of the clinical presentation. 5. Formulation of a treatment plan based on the confirmed diagnosis. 6. Ongoing reassessment of the patient's condition and response to treatment. Question 14. To address the challenge of a 65-year-old male presenting with acute, severe right hip pain and inability to bear weight following a fall, after initial assessment reveals tenderness over the greater trochanter and limited range of motion, which of the following diagnostic and management strategies best aligns with comprehensive osteopathic medical licensing examination level 2 principles for musculoskeletal assessment? Option A. Initiate a course of osteopathic manipulative treatment targeting the hip joint and surrounding soft tissues, and prescribe oral analgesics for pain management. Option B. Advise the patient to rest at home, apply ice packs, and return in 2 weeks if symptoms persist, assuming the fall was minor and the pain is likely superficial contusion. Option C. Prescribe a strong opioid analgesic for immediate pain relief and schedule a follow-up appointment in 1 month, without further diagnostic imaging or physical examination beyond the initial complaint. Option D. Order a plain radiograph of the right hip and pelvis, perform a focused physical examination of the hip and surrounding neurovascular structures, and consider referral to an orthopedic specialist if initial imaging or examination suggests a fracture or significant soft tissue injury. The correct answer is A. Initiate a course of osteopathic manipulative treatment targeting the hip joint and surrounding soft tissues, and prescribe oral analgesics for pain management. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misdiagnosis and delayed appropriate treatment of a complex musculoskeletal condition. The physician must integrate subjective patient reports with objective physical findings and imaging results, while also considering the patient's overall health status and potential for comorbidities. The urgency of the situation, indicated by the patient's severe pain and functional limitation, necessitates a prompt and accurate assessment to prevent further complications or chronic disability. The physician's responsibility extends beyond immediate symptom relief to establishing a definitive diagnosis and developing a comprehensive, evidence-based treatment plan. Correct approach analysis. The correct approach represents best professional practice by prioritizing a thorough and systematic diagnostic process. This involves a detailed history, comprehensive physical examination focusing on the affected joint and surrounding structures, and judicious use of diagnostic imaging. This aligns with the principles of osteopathic manipulative treatment (OMT) and general medical practice, emphasizing a holistic understanding of the patient's condition. The physician's commitment to consulting with a specialist further demonstrates adherence to ethical guidelines and the principle of providing the highest standard of care by leveraging expertise when necessary. This approach ensures that the patient receives the most appropriate and effective management for their condition, minimizing the risk of iatrogenic harm and maximizing the potential for recovery. Incorrect approach is analysis. One incorrect approach involves immediately initiating OMT for suspected bursitis without a definitive diagnosis. This fails to adhere to the principle of first, do no harm by potentially exacerbating an undiagnosed condition or delaying treatment for a more serious underlying pathology, such as a fracture or infection. Regulatory frameworks emphasize evidence-based practice and a systematic diagnostic approach before intervention. Another incorrect approach is to solely rely on the patient's self-diagnosis of bursitis and prescribe pain medication without a physical examination or imaging. This neglects the physician's professional responsibility to conduct an independent assessment and verify the patient's assumptions. Ethical guidelines and medical practice standards mandate a physician-led diagnostic process, not passive acceptance of patient pronouncements. A third incorrect approach is to dismiss the patient's symptoms as minor and advise rest without further investigation. This demonstrates a failure to adequately assess the severity of the patient's pain and functional limitation, potentially leading to a misdiagnosis of a significant musculoskeletal injury that requires prompt intervention. This approach violates the ethical obligation to provide diligent and thorough patient care. Professional reasoning. Professionals should approach such scenarios by first gathering comprehensive subjective information, followed by a detailed objective physical examination. This should then guide the selection of appropriate diagnostic tests, such as imaging. If the diagnosis remains unclear or the condition is complex, consultation with a specialist is a crucial step in ensuring optimal patient outcomes. This systematic, evidence-based approach, coupled with a commitment to patient safety and continuous learning, forms the foundation of sound professional decision-making in musculoskeletal care. Question 15. Benchmark analysis indicates that a patient presents with fatigue, weight gain, and cold intolerance. The physician suspects a thyroid disorder. Considering the synthesis, release, and action of thyroid hormones, which of the following diagnostic strategies best reflects a comprehensive understanding of endocrine physiology in this context? Option A. Focusing solely on the patient's subjective report of feeling cold, as this is a classic symptom of hypothyroidism. Option B. Measuring serum TSH and free T4 levels to assess the functional status of the hypothalamic pituitary thyroid axis. Option C. Administering a synthetic thyroid hormone and observing for symptom improvement to confirm the diagnosis. Option D. Ordering a test for antibodies against the thyroid gland without first assessing baseline thyroid hormone levels. Correct answer is B. Measuring serum TSH and free T4 levels to assess the functional status of the hypothalamic pituitary thyroid axis. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting complex endocrine feedback loops, which can lead to incorrect diagnostic conclusions and inappropriate treatment plans. The physician must integrate knowledge of hormone synthesis, release mechanisms, and cellular action with patient presentation to arrive at the correct diagnosis. The challenge lies in differentiating between primary endocrine gland dysfunction, secondary pituitary or hypothalamic issues, and peripheral resistance to hormone action, all of which can manifest with similar symptoms. Careful judgment is required to avoid oversimplification and to consider the nuanced interplay of hormonal regulation. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's signs and symptoms in the context of known endocrine physiology. This includes understanding how disruptions at different levels of the hypothalamic pituitary adrenal (HPA) axis, for example, would affect cortisol synthesis, release, and downstream effects. Best professional practice, as guided by the principles of osteopathic medicine and the standards of care for the COMLEX Level 2 exam, mandates a thorough understanding of these physiological processes to accurately diagnose and manage endocrine disorders. This approach aligns with the ethical obligation to provide competent and evidence-based care, ensuring patient safety and well-being. Incorrect approach is analysis, an approach that focuses solely on a single hormone's level without considering the broader regulatory context, e.g., feedback mechanisms, other interacting hormones, is professionally unacceptable. This fails to acknowledge the interconnectedness of the endocrine system and can lead to misdiagnosis. For instance, Elevated levels of a hormone might be a compensatory response to a downstream problem, not the primary issue. An approach that relies on anecdotal evidence or unverified patient reports without correlating them with objective physiological data is also professionally unsound. While patient history is crucial, it must be integrated with diagnostic testing that reflects actual endocrine function. This deviates from the evidence-based practice expected in medical licensing examinations. An approach that prematurely concludes a diagnosis based on superficial symptom overlap without a comprehensive understanding of the underlying hormonal cascade is a significant ethical and professional failure. This demonstrates a lack of depth in applying physiological knowledge and can result in patient harm due to incorrect treatment. Professional reasoning. Professionals should employ a structured decision-making process that begins with a thorough patient history and physical examination. This is followed by formulating a differential diagnosis based on the presenting symptoms and the principles of endocrine physiology. Diagnostic testing should then be strategically chosen to elucidate the specific site and nature of the endocrine dysfunction, considering feedback loops and potential interactions. Finally, treatment decisions should be guided by the confirmed diagnosis and a comprehensive understanding of hormone action and its physiological consequences. This systematic approach ensures that clinical reasoning is grounded in scientific understanding and patient-centered care. Question 16. The control framework reveals a patient presenting with a persistent cough and stridor. Considering the anatomical structures of the respiratory system, which of the following locations is most likely to be the primary site of the pathology causing these specific symptoms? Option A, the bronchioles. Option B, the alveoli. Option C, the pleural space. Option D, the trachea. Correct answer is D, the trachea. Explanation. The control framework reveals a scenario where a physician must differentiate between conditions affecting the upper and lower respiratory tracts, requiring a precise understanding of the anatomical structures involved. This is professionally challenging because misidentification can lead to delayed or inappropriate treatment, potentially worsening patient outcomes and violating standards of care. The physician must apply knowledge of the trachea, bronchi, and lung parenchyma to accurately diagnose and manage the patient's condition. The correct approach represents best professional practice because it aligns with the diagnostic principles of osteopathic medicine, emphasizing the interconnectedness of anatomical structures and their functional implications. By correctly identifying the location of the pathology within the respiratory system, the physician can initiate targeted and effective therapeutic interventions, adhering to the ethical obligation to provide competent and evidence-based care, as mandated by osteopathic licensing boards and professional guidelines. An incorrect approach that focuses solely on superficial symptoms without considering the underlying anatomical structures fails to meet the standard of care. This represents a regulatory failure by neglecting the fundamental principles of anatomical diagnosis, which is a cornerstone of medical practice. Another incorrect approach that misattributes pathology to a different segment of the respiratory tract, such as confusing a tracheal issue with a bronchial one, demonstrates a lack of clinical judgment and anatomical knowledge, leading to potential harm and a breach of professional responsibility. A third incorrect approach that relies on anecdotal evidence or non-validated diagnostic methods rather than established anatomical and physiological principles is a direct violation of evidence-based practice guidelines and regulatory requirements for physician competence. Professional decision-making in such situations requires a systematic approach. First, a thorough patient history and physical examination, focusing on the location and nature of symptoms. Second, the application of anatomical knowledge to hypothesize potential sites of pathology. Third, the use of appropriate diagnostic tools to confirm or refute these hypotheses. And finally, the development of a treatment plan based on the confirmed diagnosis and established medical guidelines. This iterative process ensures that clinical decisions are grounded in sound scientific principles and patient safety. Question 17. The assessment process reveals that a physician has observed a patient engaging in behavior that, if continued, could pose a significant risk to the patient's own safety and potentially to others in the community. The physician is aware of the patient's underlying biochemical imbalances that may be contributing to this behavior, but the patient has been resistant to discussing or addressing these imbalances. The physician is considering how to proceed. Which of the following represents the most ethically and professionally sound course of action? Option A. Discuss the patient's behavior and potential risks with other physicians in the practice, seeking their advice on how to manage the situation. Option B. Document the observed behavior in the patient's chart but take no further action, as the patient has not explicitly consented to intervention for this specific behavior. Option C. Immediately report the patient's behavior to the state medical licensing board, citing concerns about public safety. Option D. Directly discuss the observed behavior with the patient, explaining the potential risks and exploring their willingness to engage in treatment for their biochemical imbalances. The correct answer is D. Directly discuss the observed behavior with the patient, explaining the potential risks and exploring their willingness to engage in treatment for their biochemical imbalances. Explanation. The assessment process reveals a complex ethical dilemma involving patient confidentiality, professional integrity, and the potential for harm. The scenario is professionally challenging because the physician has a duty to protect patient information while also having a responsibility to ensure patient safety and potentially prevent harm to others. Balancing these competing obligations requires careful judgment and adherence to established ethical and legal principles. The correct approach represents best professional practice because it prioritizes patient well-being and upholds the physician's ethical and legal obligations. By directly addressing the patient about the observed behavior and its potential consequences, the physician attempts to resolve the issue at the most immediate level, respecting the patient's autonomy while also fulfilling the duty of care. This approach allows for a direct intervention, education, and the exploration of underlying issues that may be contributing to the patient's behavior. If the patient is receptive, this can lead to a positive outcome without breaching confidentiality unnecessarily. If the patient is not receptive, the physician has a clear path to escalate the concern appropriately, having already attempted a direct, patient-centered resolution. This aligns with principles of beneficence, non-maleficence, and respect for autonomy, as well as the osteopathic principles of treating the whole person. An incorrect approach that involves immediately reporting the patient's behavior to the licensing board without attempting to address the issue with the patient directly would be a regulatory and ethical failure. This bypasses the opportunity for direct patient intervention and education, potentially damaging the physician-patient relationship and failing to explore less restrictive means of addressing the concern. It could be seen as a premature escalation that violates the principle of proportionality. Another incorrect approach, such as ignoring the observed behavior due to a desire to avoid confrontation or potential negative repercussions, represents a failure to uphold the duty of care and a potential violation of professional standards. This inaction could lead to harm to the patient or others, and would be a dereliction of the physician's ethical and legal responsibilities. It fails to act in accordance with the principles of beneficence and non-maleficence. A further incorrect approach, such as discussing the patient's behavior with colleagues without a clear clinical or supervisory need, would constitute a breach of patient confidentiality. This violates HIPAA regulations and ethical guidelines that mandate the protection of sensitive patient information. Such a discussion, if not for a legitimate professional purpose, is unprofessional and can erode patient trust. The professional decision-making process for similar situations should involve a systematic evaluation of the risks and benefits of each potential action. This includes 1. Assessing the severity and imminence of potential harm. 2. Considering the physician's ethical and legal obligations, e.g., duty of care, confidentiality. 3. Exploring options for direct intervention with the patient, including education and support. 4. Consulting with supervisors or ethics committees if the situation is complex or uncertain. And 5. Documenting all actions taken and the rationale behind them. The goal is to achieve the best possible outcome for the patient and others while adhering to professional standards and legal requirements. Question 18. Consider a scenario where a 65-year-old male presents with generalized weakness, confusion, and a history of diuretic use for congestive heart failure. Laboratory investigations reveal a serum sodium of 128 mx/L, serum potassium of 2.8 mx/L, serum chloride of 85 mx/L, and a serum bicarbonate of 35 mx/L. His blood pressure is 95/60 mmHg, and he has dry mucous membranes and decreased skin turgor. Which of the following initial management strategies is most appropriate for this patient? Option A. intravenous infusion of sodium bicarbonate. Option B, administration of potassium-sparing diuretics. Option C, intravenous infusion of isotonic saline. Option D, fluid restriction. Correct answer is C, intravenous infusion of isotonic saline. Explanation. This scenario presents a common clinical challenge in managing patients with complex fluid and electrolyte imbalances, specifically focusing on the interplay between renal physiology and acid-base balance. The professional challenge lies in accurately diagnosing the underlying cause of the patient's metabolic alkalosis and hyponatremia, which can have multiple etiologies, and then implementing a treatment plan that addresses both issues without exacerbating the other. Careful judgment is required to differentiate between intrinsic renal causes, diuretic effects, and volume depletion, as each necessitates a distinct therapeutic strategy. The correct approach represents best professional practice because it directly addresses the most likely underlying cause of the patient's presentation based on the provided clinical information and standard physiological principles. Understanding that volume depletion often triggers secondary hyperaldosteronism, leading to renal loss of potassium and hydrogen ions, is crucial. Therefore, restoring intravascular volume with isotonic saline is the cornerstone of treatment for volume-depleted metabolic alkalosis and hyponatremia. This approach aligns with the principles of evidence-based medicine and the ethical obligation to provide appropriate and effective care. The osteopathic principles of treating the whole person and the body's inherent ability to heal are also supported by addressing the root cause of the imbalance. An incorrect approach involving the administration of potassium-sparing diuretics would be a significant regulatory and ethical failure. Such a treatment would not address the underlying volume depletion and could worsen the hyponatremia by promoting further sodium excretion, while potentially not correcting the alkalosis effectively. Furthermore, administering a diuretic without a clear indication and without addressing the primary volume deficit constitutes a deviation from accepted medical standards and could be considered negligent care. Another incorrect approach, administering bicarbonate, would be inappropriate and potentially harmful. While bicarbonate is used to treat acidosis, this patient has alkalosis. Administering bicarbonate would exacerbate the metabolic alkalosis and could lead to paradoxical aciduria, worsening the potassium and hydrogen ion losses. This represents a failure to accurately diagnose the acid-base disturbance and apply appropriate therapeutic interventions, violating the standard of care. A third incorrect approach, restricting fluid intake, would be detrimental. The patient is volume depleted, and fluid restriction would worsen this state, potentially leading to further renal dysfunction and exacerbating the hyponatremia through the syndrome of inappropriate antidiuretic hormone secretion, SIAD, if that were the underlying cause, or simply worsening the hypovolemia. This approach fails to recognize the critical need for volume repletion in this specific context. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough patient history and physical examination to assess volume status, medication use, especially diuretics, and symptoms. 2. Review of laboratory data including electrolytes, renal function, and acid-base status. 3. Formulation of a differential diagnosis for the metabolic alkalosis and hyponatremia, considering common causes like diuretic use, vomiting, nasogastric suction, and volume depletion. 4. Prioritization of interventions based on the most likely diagnosis and the immediate needs of the patient, with a focus on restoring physiological balance. 5. Continuous monitoring of the patient's response to treatment and adjustment of the therapeutic plan as necessary. 6. Consultation with specialists if the diagnosis or management remains unclear. Question 19. The investigation demonstrates a 65-year-old male presenting with recurrent episodes of orthostatic hypotension, bradycardia, and impaired thermoregulation, particularly in hot environments. He reports a history of gradual onset of constipation and erectile dysfunction. His neurological examination reveals diminished vibratory and proprioceptive sensation in the lower extremities. Which of the following diagnostic strategies best addresses the underlying autonomic dysfunction? Option A. Immediate referral to a neurologist for a lumbar puncture to rule out infectious causes. Option B. Comprehensive autonomic reflex testing, including Valsalva maneuver, tilt table testing, and quantitative pseudomotor axon reflex testing. Option C. Empiric trial of a beta blocker to manage the bradycardia and orthostatic hypotension. Option D. Administration of a cholinergic agonist to assess pupillary light reflex response. Correct answer is B. Comprehensive autonomic reflex testing, including Valsalva maneuver, tilt table testing, and quantitative pseudomotor axon reflex testing. Explanation. The investigation demonstrates a patient presenting with symptoms suggestive of autonomic dysfunction, specifically impacting the sympathetic and parasympathetic pathways. This scenario is professionally challenging because accurate diagnosis and management require a nuanced understanding of neuroanatomy and physiology, coupled with the ability to differentiate between the effects of sympathetic and parasympathetic stimulation or blockade. The physician must consider the potential for iatrogenic causes, underlying disease processes, and the patient's overall clinical picture. The correct approach represents best professional practice by focusing on a systematic diagnostic process that correlates clinical findings with known autonomic pathways. This involves careful history taking, physical examination including autonomic reflex testing, and judicious use of diagnostic modalities. This aligns with the osteopathic principles of patient-centered care and the understanding of the body as an integrated unit, where dysfunction in one system can affect others. Regulatory and ethical guidelines for the Comprehensive Osteopathic Medical Licensing Examination Level 2, COMLEX USA Level 2, emphasize the application of scientific knowledge to clinical problem solving, ensuring patient safety and effective treatment. This approach prioritizes evidence-based medicine and a thorough understanding of the neurophysiological basis of the patient's symptoms. An incorrect approach that relies solely on empirical treatment without a clear diagnostic rationale fails to meet professional standards. This could lead to misdiagnosis, delayed treatment of the underlying cause, and potential harm to the patient through inappropriate interventions. Ethically, this violates the principle of non-maleficence. Another incorrect approach might involve over-reliance on a single diagnostic test without considering the broader clinical context, potentially leading to misinterpretation of results and inappropriate management. This demonstrates a failure to apply comprehensive clinical reasoning, a core competency assessed by COMLEX USA Level 2. A third incorrect approach could be to dismiss the symptoms as nonspecific without adequate investigation, which is a failure to uphold the physician's duty of care and could result in significant morbidity for the patient. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive patient information, history, physical exam. 2. Formulate a differential diagnosis based on the presenting symptoms and known autonomic pathway functions. 3. Select appropriate diagnostic tests to confirm or refute differential diagnoses, prioritizing those that directly assess autonomic function. 4. Develop a treatment plan based on the confirmed diagnosis, considering the specific sympathetic or parasympathetic involvement. 5. Monitor patient response and adjust treatment as necessary. This systematic process ensures that patient care is evidence-based, safe, and ethically sound, adhering to the standards expected in osteopathic medical practice. Question 20. Upon reviewing the gastrointestinal physiology of a 55-year-old male presenting with chronic diarrhea, steatorrhea, and significant weight loss, which of the following diagnostic strategies best reflects an implementation challenge in assessing potential malabsorption? Option A. Performing a comprehensive evaluation including a detailed dietary history, stool studies for fat and specific pathogens, serological markers for celiac disease, and potentially a small intestinal biopsy to investigate the underlying cause of malabsorption. Option B. Recommending a trial of pancreatic enzyme replacement therapy based on the presence of steatorrhea alone, without further investigation into other potential causes of fat malabsorption. Option C. Initiating empirical treatment with broad-spectrum antibiotics and a high-fiber diet to address potential dysbiosis and improve stool consistency. Option D. Ordering a battery of genetic tests for rare metabolic disorders that can cause malabsorption, without first ruling out more common etiologies. The correct answer is C. Initiating empirical treatment with broad-spectrum antibiotics and a high-fiber diet to address potential dysbiosis and improve stool consistency. Explanation. This scenario presents a professional challenge due to the need to integrate complex physiological understanding with patient-specific clinical presentation and the ethical imperative to provide accurate, evidence-based care. The physician must not only recall the intricate mechanisms of gastrointestinal digestion and absorption, but also apply this knowledge to a patient experiencing symptoms suggestive of a specific malabsorptive state. The challenge lies in differentiating between various potential causes and selecting the most appropriate diagnostic and management strategy, all while adhering to the standards of care expected of a licensed osteopathic physician. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based diagnostic process. It involves a thorough history and physical examination to gather initial clues, followed by targeted laboratory investigations that directly assess the suspected physiological derangements. This methodical approach aligns with the principles of osteopathic medicine, which emphasize a holistic understanding of the patient and the interconnectedness of bodily systems. Furthermore, it adheres to the ethical guidelines of the Comprehensive Osteopathic Medical Licensing Examination Level 2, COMLEX USA Level 2, which mandates that candidates demonstrate the ability to apply scientific knowledge to clinical problem-solving in a safe and effective manner. This approach minimizes unnecessary interventions and ensures that diagnostic efforts are focused and efficient, ultimately benefiting the patient. An incorrect approach that relies solely on empirical treatment, without a clear diagnostic pathway, fails to meet professional standards. This could lead to delayed diagnosis of the underlying cause, prolonged patient suffering, and potential iatrogenic complications from inappropriate therapies. Ethically, it violates the principle of beneficence by not actively seeking to identify and address the root of the patient's problem. Another incorrect approach, such as ordering a broad, unfocused battery of tests without a guiding hypothesis, is inefficient, costly, and may expose the patient to unnecessary risks associated with invasive procedures or laboratory analyses. This demonstrates a lack of clinical reasoning and a failure to apply the principles of diagnostic stewardship, which are implicitly expected within the regulatory framework of medical licensing examinations. A third incorrect approach, focusing on a single, less likely etiology without considering other significant possibilities, represents a failure in differential diagnosis and can lead to a misdiagnosis of a more serious or common condition. This directly contravenes the expectation of comprehensive clinical assessment and management. The professional decision-making process in such situations should involve a structured approach. First, thoroughly elicit the patient's history and perform a comprehensive physical examination to identify key signs and symptoms. Second, formulate a differential diagnosis based on this information, considering the most likely physiological mechanisms underlying the patient's complaints. Third, prioritize diagnostic investigations that will most effectively differentiate between the plausible diagnoses, starting with less invasive and more cost-effective tests. Fourth, interpret the results of these investigations in the context of the patient's clinical presentation and adjust the diagnostic and management plan accordingly. This iterative process ensures that patient care is guided by sound clinical judgment and adherence to established medical principles.